Dr. Sheila Maguiness, welcome to the Motherly Podcast.
Thank you so much, Liz. It's just an honor to be here.
Okay, so in addition to being a pediatric dermatologist, you are also a mother to two boys. I always like to ask my guests, coming from their backgrounds and perspectives, what surprised you the most about motherhood?
Oh my gosh, I think the best thing to say would be what didn't surprise me.
Mm.
Um, Motherhood was not what I expected, and it turned out to be so much more, but also a lot harder. I'll share with you a little story. Having children a little later in life because of my medical training and the journey that I went on with my career. I was 36 when I had my first son. And, at that point, was already a pediatric dermatologist in a busy practice and had a lot of peds training. And, my husband and I were very naive. We really thought, oh man, basically you're a pediatrician. This birth is going to be easy. This child is going to be easy. This little guy is going to fit neatly into our lives. We're still going to go out to restaurants. We're still going to do all the things that we used to do. And let me tell you, that was really not the case at all.
I love how you put that it was so much more than I expected. That is so true. I mean, that is what I expected. I thought it was like, okay, this is another milestone on my adulthood journey. And it wasn't. I mean, it was, but it was also a reshaping of who I am, what I think about myself, what I even thought I was capable of. What for you was that more? What did that look like? What did that feel like?
So that more for me was just a reorganizing of priorities and just an enormous new love and new direction that you take your life in that was for me a little unexpected. I'd always been very focused on career and, achieving in academics. And then all of a sudden, this little bundle came along and kind of reorganized all of those priorities.
Hmm. When you think back to, some of those early moments when you realized this isn't just another achievement, this is a reshaping, was there a specific experience, something you struggled with in new motherhood that helped you realize how much more this was than you expected?
Yes, so new motherhood was a big struggle. And I'll just share with you a story. You know, my first little boy, Charlie, is just an exceptional, wonderful, lovely little boy. And I'm just so proud of him and just seeing his little 10-year-old personality come out. But he did not enter this world in a very easy way. I
Hmm.
ended up having to have an emergency C-section for HELP syndrome, which is a hypertension kind of preeclampsia syndrome. And my dreams of an easy birth and drinking wine after the birth with my husband in celebration was completely different from what happened. Being hooked up to an IV with magnesium sulfate and not feeling well, and all of those emotions of an unexpected event, and then the struggle of kind of getting used to this new baby and really feeling, even though I was medically trained, gosh, what do I do now? I'm a mom. How do I make this work? And then just day by day, a different direction emerged, and so you kind of turn that struggle into something new. And you can do that because the love you have and all of those emotions kind of take you on a totally new journey.
Mm-hmm. And, just I had fairly uneventful births. That was my story. But, I can imagine having a psychologically and physically traumatic birth can really also reshape early motherhood for you, especially if it's your first time.
It did. I won't say it was easy. It was tremendously difficult. And I think there are lots of things that I am so glad that you and your podcast are bringing light to in terms of, the struggle with mood, the struggle with sleep. All of those things are real. And we
Mm.
as moms and professional moms need to talk about it, acknowledge it, and help each other through it. So I think those are
Mm-hmm.
really important things.
All right, I want to talk a little bit about your professional journey. Tell me about why you wanted to go into medicine, why you wanted to become a doctor, and then specifically dermatology. What did that mean to you?
So, my story kind of takes a lot of turns. It definitely wasn't a straight one.
Interesting.
I really was always very fascinated by the skin. I struggled with acne myself as a teenager. And then in my undergraduate degree, I ended up basically getting a serious illness. I had a very bad adverse drug reaction that affected my body very badly. It was basically like a form of inflammatory arthritis. And that experience of being the patient really shaped my
Mm,
desire to help others and to, pursue medicine. And so when I went into medical school, I had a very open mind. I always knew that I wanted to work with children. Pediatrics was
mm,
definitely for me. And so that journey towards pediatric dermatology took a turn when I did a month-long internship at the Hospital for Sick Children, studying and helping children with cancer. I thought, if I can handle this and do what I think would be the most difficult part of pediatrics, then maybe I should do, pediatric residency.
mm-hmm.
And it was interesting because during that time, I actually came across some patients that had very unique and rare blood vessel growths or vascular tumors or malformations. And it really piqued my interest. I thought, gosh, this is a field that's emerging. Nobody knows a
Mm-hmm.
lot about it. And I basically kind of made it a goal of mine to learn and become an expert in that field, which kind of took
Mm.
me to a fellowship in pediatric dermatology at the University of California, San Francisco, where I studied, vascular anomalies and did my fellowship and really honed in on that area that I was interested in academically and research wise.
Which I love that you went in with this open mind, but you also noticed like, wow, I could actually make a difference here. I love that. I think as so many of us think about where our careers fit, even now, right? During a time of great change for mothers and their careers, following your curiosity, seeing, the intersection of your curiosity, the growth in trends in an industry. It's really interesting how that experience ended up leading you to today where you have a busy academic practice. I know you're obviously a pediatric dermatologist, also the chief product officer of a new skincare startup. It's really interesting that journey that you went on, all the twists and turns as you described. So catch us up to where you are today and why you decided to take on this new challenge at Strike Club.
Well, thanks. Yeah, this is definitely a new direction for me. So, having spent a decade in academic medicine, furthering research and caring for patients, I started to notice that many teens didn't seem to have the tools to take good care of their skin. No matter what we wanted them to do, it was really hard to get them to engage. And I found that
Mm,
to be actually even more so true for boys, for teen boys. And so that was something that I had been noticing. And then, my time in San Francisco gave me some connections to some really good friends. And one of those friends is Darcy Rosenblum, who is a marketing guru and one of my partners. And she's just amazing. And she approached me two years ago with the idea for Strike Club.
mm,
It was the idea of, we're four moms, four founders trying to find solutions for teen boys when it comes to skincare and personal care. So because I'm the mom of two very active boys, this was an idea that resonated really well with me
mhm,
and something that I just kind of felt that I needed to do. It was
mhm.
quite, a scary journey from, changing from my practice to putting on a totally new role and learning almost like a new language.
Mm-hmm.
But it's been an amazing journey and really in the past 2 years, a very fresh creative output for me.
For sure. I actually want to kind of ground this part of our conversation in what skin is in health in general. So I'm a journalist by trade. I'm coming from a not medically or even scientifically trained background, although I read a lot about it. So I read that your skin, for example, your skin is your body's largest organ. which I find super interesting to think about. I don't quite know what it means to say that the skin is the body's largest organ. What is an organ and what does it signify in our overall health? Like, why should we care this much about the health of our skin?
Well, you're absolutely right. The skin is the largest organ and it has the most important function. It keeps all of our parts inside and keeps, all of the water inside and protects us from the environment. It has amazing structures. It's always turning over, protecting you from the environment, keeping out bacteria, fungus, allergens. It truly is amazing. And I think we're only just scratching the surface of what actually the skin does. We still have a lot more to learn. But it's very important to care for your skin. There are many different, there's over 3,000 different skin diseases that can manifest. And sometimes the skin is the first presenting sign of an internal illness in the body. So, our dermatology training helps us to look for those patterns and clues in the skin, the shape of lesions, the color of lesions, to really make those connections as to what might be going on underneath in the body. So really, it's a fascinating area, and yeah, one that I think it's definitely still emerging.
Well, yeah. And I was also thinking about how we are really a new generation of parents looking at the products that we put in and on our bodies in a really new way. Like, we're a generation that's obsessed with clean beauty, that concept, right? And I'm reflecting back that for me, almost like my awakening and awareness around what I'm putting on my skin started just like when I was thinking about having a baby for the first time. Can you talk about how we can use the experience of pregnancy and postpartum and motherhood to really like better understand and evaluate what we're putting on our bodies every time we, put on a different product, and what we might want to look out for, especially, when you're pregnant and breastfeeding. We want to be safe. So what do we need to look out for, and why is it so important to use that part of the journey to really reevaluate what we're doing with our skin?
I think that you've just hit the nail on the head. I think that the transition from adulthood, to motherhood really does kind of make you more aware of what is going into and on your body. Think of all the things that we limit in terms of diet because it may not be good for the baby, like, fresh cheeses and, of course, alcohol, all of those things. We start to become more aware of what is safe for the developing baby. And the same is true with skin. There are certain ingredients and certain things that are classified as, not safe in pregnancy. And many women who are about to be, new moms are probably using a lot of those products already, like the retinols or tretinoin, those topical retinoids, which is a category that we really don't think should be used in pregnancy. So that is definitely a time when I think the mom's mindset shifts. And then
Yes.
that is true even more so when the baby is born and we have all these new moms thinking, how can I keep this baby as safe and healthy as possible, especially with respect to their skin? Because again, it's what is better than baby skin? That's my job, which I love all day long, is what is more beautiful and soft and wonderful than newborn skin, and how do we keep it healthy and use safe ingredients? And I agree, there is this movement towards clean beauty. And some of it is great. And then there are some parts that might not be so great, or misinformation surrounding that concept, I think.
Yeah. Tell me more about that.
So a lot of moms in my practice talk about natural. They want to do things that are natural. They want to use plant-based items. They want to use essential oils. And those things are natural for sure. But they also may have unintended biologic activity that we just don't know and is not well studied yet. So I like to draw the example to poison ivy or poison oak. That's totally natural, but it gives you a terrible rash for weeks on end. So not everything that's natural is necessarily non-allergenic. And when it comes to baby skin, Liz, it is very sensitive. It is 20 to 30% thinner than adult skin, more prone to absorption of chemicals and irritants from things that we apply to it. So one of my big, pet peeves in terms of baby care is seeing a lot of, in an attempt to be natural and to kind of play to the consumer, a lot of companies are putting a lot of botanical
Hmm.
ingredients, essential oils, and things that I think fragrances, for example, are not good for baby skin.
That is such a good distinction, I think, for us to have in mind, that just because it's natural doesn't necessarily mean it's safe for you or for your baby. I love how you talked about just the beautiful, fresh skin of a newborn baby. Like, there is nothing better. I think there's been research that shows that, like, smelling a baby's head makes mothers' brains light up. I totally being transported back to that moment of the newborn smells and the softness. But I also know, when I had my first child, a week after he was born, his skin absolutely exploded in baby acne and a head to toe rash. And it was so scary to experience and not know what was going on. Can you talk a bit about some of the common skin related conditions that parents experience and ways maybe that we could both prevent those, perhaps by being aware of harmful ingredients? And then also, how do we treat some of the more common issues for newborn and infant skin?
Absolutely. So you brought up baby acne, and we call that cephalic pustulosis. We love to have different and long names for, for things in dermatology. I don't know, it's a thing. But baby acne can show up around 2 to 3 weeks of age. And, just like you're saying, it can show up as like these small pink bumps with pustules and some scaling. And baby acne is not true acne like you would see in a teenager because there really are no blackheads. And that's an
Mm-hmm.
important distinction because there are forms of acne that you can see in infancy that do have blackheads, but baby acne around 2 to 3 weeks of age will not result in scarring, and it typically is a reaction to yeast or Malassezia yeast on the skin. It's usually really mild and it goes away. But I do think that there are things that we can do as mothers to help and maybe prevent that. And I think that some of
Mm,
those come surrounding bathing your infant. Because there's a
okay.
lot of mixed messages and different, resources and different advice given by pediatricians on the frequency, for example, of bathing a newborn.
Mm,
And I really think that, if those microorganisms on the face of the baby are causing the hypersensitivity reaction that results in baby acne, that probably bathing the baby regularly and maybe even applying a very bland moisturizer may in fact prevent the baby acne, or at least maybe attenuate it a little bit. Now, certainly we don't have any prospective clinical trials to document that, but I think that this idea of bathing and moisturizing the baby is really important.
hmm. Yeah, you're right. We are seeing more advice like, oh, you don't need to bathe your kids as often as you think. I certainly use that advice a lot as a mom of four, but there's something unique happening with this newborn baby who's adjusting to his or her brand new environment and all the chemicals around them, natural chemicals and unnatural ones as well. So what are some of the best practices that you recommend for keeping a newborn skin healthy, thriving, and kind of enduring some of those like early flare-ups that can happen?
Yeah, so I think that the best practices for newborn skincare, and it's really just based on consensus guidelines, because again, we don't have any perfect standard of care, which I wish we did, but it's still lacking. I think bathing in a tub, like an immersion tub bath with lukewarm water, daily to every other day is a great practice. You don't need soap every time. We don't want to
Okay.
over dry and over foam. The surfactants in many of the baby cleansers out there can sometimes be a little bit harsh and strip the baby's natural oils and kind of break down the skin barrier a little bit. So I would limit the soap, maybe only using a few times a week, and just a water bath, getting the baby out, patting dry, and then massaging in a really bland, hypoallergenic, fragrance-free emollient or moisturizer. I think that's a really great practice. And even starting every other day would probably be very sufficient for most
Mm-hmm.
babies.
Okay. You also have talked about how the skin can be like a signal that something is going on inside. We've also noticed like a significant rise in babies and kids with eczema. I'm wondering if you can talk about some examples of skin conditions that you might see in infants or young kids that are actually signs of something going on, like within the deeper level of the child's health, and things we should be on the lookout for.
I think you brought up a great example of atopic dermatitis. Up to 20% of babies may show signs of atopic dermatitis or eczema. I'll use those two words interchangeably.
Okay.
And so it usually tends to show up on the skin at around 3 months, and it certainly can be predated by more severe cradle cap. So cradle cap that's really
Mm.
increased in severity or red, inflamed, and itchy might be a sign that your child is predisposed to eczema. Then what you see in infancy for children who have atopic derm is, red, pink, scaly, dry plaques on the cheeks, the extensors, outer
Mm.
arms, outer thighs, and then, of course, the scalp. And that really is the first sign that something is going wrong with that child's skin barrier. And, we've learned so much about the pathogenesis of atopic dermatitis over the past 10 years. It's actually been one of the amazing advances in scientific knowledge in the field of dermatology that has resulted in some really amazingly new and effective therapies for eczema even.
Yeah, I'm really interested in that. Does it relate at all to a rise in allergies among children? Is eczema related to allergies? And what are those innovations that you're talking about?
That is a great question. And yes, they are inextricably linked. They are very much
Okay.
so linked. And I think 10 years ago, before we had really unraveled a lot of the pieces of this puzzle, we used to think, gosh, something wrong is going on inside the body, coming out on the skin. There must be an allergy. There must be a food allergy. There must be something wrong from an inside out perspective.
Okay.
What we have found is that the link between almost all of atopic diseases, so think about asthma, think about allergic rhinitis, think about eczema, atopic dermatitis, or the nasal polyps and other allergic diseases, we're all linked. And here's why. What we have found is that atopic dermatitis is primarily a dysfunction of the skin barrier. So there are skin barrier defects that lead to and are the first kind of structural problem that lead to these allergic diseases. And I can explain that a bit more if you want and if we have time.
Yeah, no, I think my kids, so for example, one of my children has struggled with eczema off and on. But I would say the biggest way that we encounter kids with allergies is through school, actually. Like there's so many foods that we're not able to pack for our kids' meals. So even though we don't have major allergic issues in our house, I'm very aware of them. And obviously parents who have kids with significant or severe allergies, it's like a daily hardship for those families to go through. So yeah, tell me more about what's happening to our kids in their little bodies that's
Yes.
causing these. Yeah, I'm so curious about
Let
all
me
that.
try and explain the link between atopic dermatitis and food allergies because you're absolutely right. Food allergies are common, they're increasing in incidence, and they are directly related to the skin. Here's why. So it turns out that children, and that most children with atopic dermatitis are missing or deficient in a little protein in the very top
Hmm.
layer of their skin. The stratum corneum is that top layer. And they are missing or deficient in a little protein called filaggrin. And learning about the structure, function, and the purpose of filaggrin has been a key development in understanding all allergic diseases.
Wow.
So, filaggrin's job is to hold water into your skin and prevent the water from leaving, so prevent that transepidermal water loss. It's supposed to hold it in. And when it holds water in perfectly, the pH balance of your stratum corneum is great. You're good. All the other little proteins in your skin that are supposed to do their job, like fight infection, keep out allergens, they're all lining up properly and doing what they need to do. When you don't have enough, or some people are even completely deficient in filaggrin, you are
Hmm.
losing so much water through the surface of the skin. The pH balance is completely dysregulated, and all the other proteins that are supposed to do their job, like fight infection and keep out allergens, are not working. So it's almost like you have inherited a leaky skin barrier.
Hmm.
Now, here's what happens when you have a leaky skin barrier. You are getting exposed to allergens through your skin, rather than the other places like the gut that they need to be exposed in order to teach your body not to
Mm,
become allergic. And this was the really amazing part of the peanut allergy story that has been
yeah.
evolving and that now we understand better. Because, say you're a mom and you have a child with eczema who doesn't have enough filaggrin and their skin barrier isn't perfect. You go make yourself a peanut butter sandwich. You have still peanut protein on your skin. You forget to wash your hands. You touch that baby. And now, how is that peanut antigen, those peanut proteins, being exposed to the baby's developing immune system? Through the skin, which is not the right way. That's the way that leads to a hypersensitivity in your immune system, teaching your immune system to drive down an allergic inflammatory pathway rather than oral, consumption of the peanut, which helps through the gut expose your immune system in the proper manner for those allergic foods. And that is the basis that's really led to the new recommendations for early food introduction for the reduction of food allergies so that we do not have time for that baby to become sensitized through the skin. Does that make sense?
Oh, it makes sense to me hearing you explain it so well, but I'm reflecting on you have a 10-year-old son. I have a almost 10-year-old son. The advice that we have gotten on some of this has changed significantly in the 10 years since we first became mothers. Um, you're a scientist looking at this emerging research. For those like regular mom listeners who are saying, okay, what do I actually do when it comes to allergies and making sure my kids are healthy and making sure their skin is healthy? As the science is emerging, like, can you give us some concrete, what do we know now based on how this research has evolved and clarified over the last decade? What do we know now? And what are some best practices moms can use to help their kids be healthy in the way that you've described, which wasn't quite what we were taught 10 years ago?
Oh, it certainly wasn't. And I think that those in like recommendations for limiting peanut exposure until age 2, which was what we were taught, right, Liz, has
Yep.
really, I think, created even more of the peanut allergy. And
Right.
that's really important to think about because how we started to realize that we needed to promote early food introduction was this exactly this, and comparing our incidence in food allergy to other countries like Israel, who had one of the first baby foods contained peanut protein, and their peanut
Right.
allergy incidence is much lower. So these are great questions about allergy prevention. You should always work with your pediatrician, but now the guidelines are that, by 4 months of age, you can be introducing these highly allergenic foods and the proteins like soy, egg, dairy, peanut, all of those things.
I also find it almost, I want to say, like an allegory for parenting in a sense that the research is showing that introducing some things that can be stimulating to your kids' bodies in an earlier manner is actually healthier for them. It's making me just think about things that I can introduce my kids to in general, like washing the dishes or helping out. Like it's just an interesting way to think about that you actually strengthen your child's well-being by, again, talk to your doctor, but this earlier than we expected introduction of um, products that were once thought to be like it was dangerous to introduce. I just find that like an interesting twist on what we've learned over the last decade. How do you think you've implemented some of this science in your own house? Like how has it changed how you have parented your own kids?
Okay, that's a great analogy, Liz. I think it's really important as moms to introduce our kids to those things that they can do for themselves and give them the tools and empowerment so that they can help out. The more they're exposed to doing those chores and the more things they can do for themselves, I think that builds
Mm-hmm.
confidence and even resilience in our kids.
Mm-hmm.
It's important.
Mm-hmm. Well, you are a mother of two boys. I have three sons and a daughter. And in reading more about this skincare startup, Strike Club, that is focused on boys and teen boys, I found it like a really kind of inspiring and helpful message around helping boys to be able to take care of themselves. So I want, if you can tell me more about what you think was happening in the culture to make this company so relevant and important. And specifically, I mean, you talked about how teen girls are really used to the language of self-care and using skincare products. There's something they're like excited about, but that it was more difficult to introduce that to boys, and Strike Club is trying to make space to help boys have simple ways to practice self-care, deal with acne. But I think it says something really interesting about our culture and how, frankly, our generation of moms is trying to like support boys and center boys in a healthy way. So can you talk a little bit about that?
Thanks, Liz. I think you're totally right. So Strike Club was founded by four moms, and we were noticing that while our teen girls' bathrooms, my partner's teen girls' bathrooms, were overflowing with skincare products, it was hard to engage our boys to even wash their face. So what's happening there? What does that mean? I had noticed in my practice that, young boys, they do care about their appearance. The psychosocial impact of acne and skin problems is not to be minimized, but they were really lacking the tools, and the empowerment towards really engaging in self-care. One of our partners is a licensed family therapist, and she was noticing in her practice too skyrocketing rates of anxiety and depression. And there's obviously many reasons for that going on in teens right now, but part of it is, this is a very face-forward, selfie, social media generation, and boys do care. So what we wanted to do was let's help them engage in ways that make sense for them, that fits easily into their lifestyle, and let's hopefully maybe change that discussion or narrative around self-care for boys.
Um, I love it so much, but I'm curious how you're actually implementing that. So I have a 2-year-old and I have an almost 10-year-old, and my oldest son just this month is actually starting to break out for the very first time. I did not think we were going to be here, but we are here. We have some acne in the house. And it's not just about having like the physical products. It's about coaching our kids and our sons to be able to use them to practice and prioritize self-care. So do you have any advice for parents of boys and maybe unique ways that we might need to think about talking to them, coaching them through that journey, which I can't believe I'm at, around acne and growing up and puberty, because it's where parenting gets more complicated, really.
Oh, it really does, Liz, and I'm right there with you with my own 10-year-old boy and an 8-year-old, so it's just around the corner for me too. So there seems to be a perpetuating stigma around self-care for boys, almost as though they're being taught that they shouldn't care when we know that they do care. So that's a great opening conversation. Hey, I noticed, that you have been asking about skincare or wanting a cleanser, or hey, I noticed that you had a breakout. Just kind of opening up that conversation and allowing a discussion to naturally happen. Getting them to talk about it is really important. The next thing is giving them the tools that they can actually use that will fit into their lifestyle. A lot of boys just aren't going to do a 10-step routine for their skincare. It all starts with washing your face. So if you can give them access to a simple, gentle, hypoallergenic cleanser that they can use easily twice a day, that's really the first step. And, kind of gets them thinking about it, gets them into a routine, and then, kind of going from there and building depending on what their needs are.
Mm-hmm. Is that something you're already introducing with your sons, or are you just like a few years away? Where are you in that?
The formulation for our face first wash and the everywhere wash is something that my family has become obsessed with. We actually
Oh,
all use it,
really?
even my boys in the shower, and they are doing it. So my 10-year-old showers daily and uses a soap. He doesn't always use it properly, I don't think, but he definitely
Mm-hmm.
engages, and we've had those conversations, and partly because he's seen my journey and kind of going through the process of being a founder of a new company. And I think that's a great example also to set for our young boys to see that in their moms and the journey that they're taking.
Well, that's actually exactly what I was thinking about, because my 8-year-old does not know that the culture would make fun of him for being an 8-year-old who loves bubble baths, right? Because he's seen me take elaborate bubble baths, and I get the candle and I get the bath bomb, and we set the music and we dim the lights. And I love it, and it's relaxing, and it is self-care for me. And he's seen me do it. And, over the years, we've developed this bath time ritual for him when he's really angry or agitated or out of control. And I say, you know what? I know you're having a hard time. Why don't I set this nice bath up for you? And, about half the time he'll say, yes, that sounds good. And he emerges a completely different human being after this luxurious bath. But he doesn't know that that's not common for boys to do. And I'm glad that that's not common, but it's kind of getting at what you're talking about, that we need to model self-care, not just for our daughters, but for our sons, and destigmatize self-care for our sons if we want our generation of young men to be able to fully express themselves. I think so many girls and women have broken out of this narrow mold that the culture puts on them, but in some ways that mold is really tight around boys, maybe tighter now around what is masculine and not masculine for them to do. So I know it's a really important topic at our house. I'm
Yes.
curious about yours.
It's definitely an important topic at my house too, and I think having those conversations, it's funny that you mentioned the bath. My 8-year-old loves the bath, and it kind of has a similar ritual. It has a calming effect, and I think you're absolutely right. It is self-care. And sometimes I like to use the phrase, name it to tame it. So you name that what you're doing. You know what, Jack? You need to take care of your body. This is a really important thing. Name the emotion, name the act of what you're doing. And that, I think, allows more processing too.
There is so much information out there in skincare, and in the United States, a lot of these decisions are really on what products to use, what chemicals to put on your body or your kids' bodies. It's not regulated. So it's up to the consumer to make informed choices of what we want to put on our bodies and what we want to put on our children's bodies. Are there any specific chemicals, anything you think we should be looking out for that is a hard no, or something to really try and avoid? And if so, what are they?
Yeah, I can give some guidance around that for sure. When you're looking as a parent at the back of the label and trying to decipher all those ingredients, it's really confusing. You almost need, a background in chemistry to really be able to figure it out. So I really agree. There needs to be more regulation and more transparency, in what is going into the cosmeceuticals and just in skincare in general, in the health and wellness industry. But there are some ingredients that I would recommend avoiding, especially in young infants and toddlers. I think that fragrance-free products are probably best. So if it says fragrance, you should see, fragrance, or masking fragrance would be something to look for and maybe avoid in our youngest patients. I think as the skin gets thicker and matures more in our, in our teenagers, it's probably, especially if they're not sensitive to it, I'm sure that a little fragrance is okay, but still parents should keep in mind that those fragrances are not regulated. In addition, the things that sort of get a bad reputation, and probably rightfully so, are the things like parabens, sulfates, and alcohols. Alcohols can be confusing because there are some good alcohols that can be hydrating, and then there are ones that are more drying to the skin, like denatured alcohol or isopropyl alcohol. Those are things to avoid.
Okay.
And we had talked before about essential oils. I think that kind of hits the fragrance category. Avoiding that, especially in our youngest patients, is probably recommended.
Okay. Another area that I personally find a little bit confusing is sunscreen. I have some very pale children, and we need a lot of sunscreen to be safe. But I also have read about the need for vitamin D and wanting some, access to the sun through our skin. So help me understand, what are some safe, important sunscreens? And is there any part of childhood that we should be sunscreen free? How do we balance those two things?
This is a question dermatologists get all the time. And so our recommendation is that you don't, use the sun to get your daily quotient of vitamin D. That's not the safe way to do that. Most of
Okay.
us, living in certain areas of the country, vitamin D deficiency is a real thing just based on the climate in general. Minnesota is a great example. Certainly, an oral form of vitamin D to keep those levels good would be the recommendation rather than trying to
Okay.
get, vitamin D through the skin. So sunscreen
Okay.
and sun protection is very important because skin cancer is one of the main concerns later on, and the sun that you get before age 20 is the most important. Repeated sunburns early in childhood are very predictive of increased risk for skin cancers, including melanoma over a
Mm.
child's lifetime.
That's a lot of pressure, by the way. Like that the way you put that though, like that's real. That probably one of the most important things we can do is prevent sunburns, and especially severe and repeated sunburns. So that definitely puts it in perspective of how impactful under the sun exposure before your kids are 20.
Yeah, it's really important.
Okay.
So, sun protection isn't all about sunscreen. We have to think there are lots of ways to protect ourselves from the sun. Sun protective clothing is having a moment. I think it's really done a great job. Like, as companies make lightweight, sun protective clothing that looks great, that kids will wear, those rash guards, really important. A broad hat, the long sleeve rash guard, shade, making sure that your children can have access to shade or shade structures when you're going to be out all day, really important. And then using the UV index as a guide. We all have our smartphone devices and we have the weather app. We can see what the UV index is at any given time. And if it's high, you need to be, fully protected.
Mm.
And so sunscreen becomes a smaller part of the conversation, but still a very, very important one for exposed areas.
Mm-hmm. Okay, that's really helpful. I know since I was a kid, all we had were like little bikinis or Speedo bathing suits. And now I don't send my kids to the pool without wearing the full sleeves. And they're so easy to find. That's a real helpful advance, I think, for parents in the summer. That didn't exist when I was little.
No, me either. But now I echo you. When my children go to the beach, they basically look like they're wearing a unitard. I've got the long pants
Pretty
sometimes, I've
much.
got the long shirt. And so that's a really great way because it's so much easier to put on that sun shirt than it is to get enough sunscreen reapplied as frequently as you need to achieve the SPF on the bottle. So, that becomes really an integral part of your, sun care armamentarium, I think.
I agree. Is there anything else about skincare and raising kids that you think is important for our listeners to know?
Gosh, I like the idea of early empowerment, of getting your kids to engage in the care of their skin and talking about it as a form of self-care. I think those are really nice lessons to reinforce early. Getting them to understand what is, healthy, and if their skin is dry or itchy, what can they do about it? Those are all lessons that I hope that we can, give our kids.
Mm-hmm. So you're a doctor, you're a startup co-founder, you're a mother. In your dream worlds, when your boys are bragging on you someday, talking about their mom and how proud they are, like, what do you hope that they say about you?
I hope that they are able to look back on a childhood filled with love and laughter and feel that they have benefited from having a mom with a career who was trying to be a strong role model for them.
Hmm. I love that. So at Motherly, we believe that motherhood brings out our superpowers. I think of that in a lot of ways as what you talked about as the more of motherhood, that it was more, and that you became more than you even knew you were about to become. So again, those are superpowers, those are forces, those are things within you, maybe that you didn't even know were in there before you became a mother. So I am curious, what is your superpower?
Oh, I love that you brought it back to the more. That's just such a great thing to think about. And I think you're right. I certainly don't feel like I have superpower powers. That's one thing. I certainly don't feel that I have superpowers, but if there's one thing that I have learned from, I would say even the last 3 years of, being a mom, helping my kids succeed, being an academic, physician, and then this new startup, I think that moms innately know how to multitask. And I think that can be one of our superpowers, knowing how to meet everyone's needs simultaneously.
Mm.
So that I think is definitely something that I've gotten better at, and that I think that my children notice.
Mm. I'm curious how we didn't talk about this that much in the episode, but how you meet your own needs in such a busy schedule. We talked about self-care for your kids, but are there things that have become essential in filling your own cup with all the hats that you wear?
Very important question. And you're right. I think sometimes as moms, we put ourselves last. And so your own self care becomes really important because you do need to fill that cup so that you have enough for everyone else. And I would say that for me, because I love my work so much, it feels like a hobby for me. It doesn't actually feel like work a lot of the time. So that is something that I actually try to teach medical students as well.
Wow.
Notice what feels like a hobby and then do that. Make sure that you don't feel like you're just killing time or just going through the motions. If you love what you're doing, from my career standpoint in academics, I have loved that. This new journey, in Strike Club, I have also loved that as more of a creative outlet. But in the end, prioritizing time
Mm-hmm.
with family, being present with family, prioritizing time with my partner, my husband, all of those things are really, really essential as well so that I can keep going.
Hmm. Well, that was a great answer. And I definitely feel that getting to host this podcast and talking to you and other amazing mothers is the kind of work that doesn't feel like work. So thank you for that. Thanks for all you shared today with our listeners. Dr. Sheila Maguiness, thank you so much for joining us today on the Motherly Podcast.
Thank you so much for having me. It's been a pleasure.